Hello, Miss Smith. My name is Shantae, and I will be your nurse for today. I am here for your medication pass, your evening medication meds. And before we get started, I'm going to go first wash my hands, and I'll be right back. Okay, I'm washing my hands. Okay, Miss Smith, I'm going to just pull the curtains to provide privacy. Is that okay with you?
Yes, ma'am.
Okay, Miss Smith, before we get started, I just want you to state your name and date of birth.
My name is Miss Smith, and my birthday is 02/16/1992.
Okay, good. Okay, Miss Smith, so I have to do 3 medication checks first before we administer your medication. And I'm just going to go ahead and check the meds and make sure that they match up with my MAR here, okay?
Okay.
Okay. Just one moment, okay? That's fine. Okay, that's good. At 3, good. 4, good. And 5, good. Okay. Okay, Miss Smith, and before we go any further, can I just see your identification band just so that I can make sure that the meds match your band? This arm. Okay. Okay. Gotcha. Okay. Great. Okay, Miss Smith. Okay. So I'm going to do my 3rd check before I give them to you. And I'm going to make sure that the meds match my MAR again and my doctor's orders just so that we clear with everything, okay?
Okay.
Alrighty. Okay. Great. Okay. Okay, Miss Smith. Okay, so before we get started, do you need any assistance with taking your meds, or can you take them by yourself?
Yes.
Okay, so I want to check your gag reflex before we start. So I'm just going to give you a sip of water. I'll be right back.
Okay.
Okay, Miss Smith, here you go. Just take a little sip for me just so I can see if your swallowing is fine. Good?
Yes.
Okay, you can set that down. Okay, Miss Smith, first we are going to take your nitroglycerin. And the nitroglycerin is 1 tab by mouth every day. And this is just for chest pains. So usually when we take the nitroglycerin, if the chest pains doesn't subside, we can take up to 3 pills, 3 tabs. And then after that, we'll have to move on to the next step. So here's your nitroglycerin. Okay.
Thank you.
Alrighty. And then our next one, Miss Smith, we have hydrocodone. This is 10 milligrams. We take this every 12 hours. So these are your evening meds. And this is just for severe pain. So there you go.
Thank you.
Okay, are you ready for your next dose? Your
Yes.
next one? Okay, so this next one is amlodipine. And this is 10 milligrams by mouth daily. And this is just to treat the high blood pressure. So we're going to take this one. That's our important med.
Yes, thank you.
Okay. And then next here we have pioglitazone. And this is the 15 milligram tablet, 15 milligram to 30 milligram tablet that we take once a day by mouth. And this is for type 2 diabetes.
Thank you.
Okay. You're doing great, Miss Smith. Next here, our last med we have is risperidone. And this is our 16 milligram med that we take every day orally. This is for the bipolar and autism, the mental disorders. So here you go.
Thank you.
Okay, Miss Smith. So do you have any more questions?
No.
No? Okay, so I'm just going to educate you a little bit on these meds. Anytime we give medicines, and I know that these are new, I don't want you to get up for a little while, so I'm going to give you your call light.
Okay.
There you go.
Thank you.
Okay, so you can just push that light. If you need me, I'll come back in and I'll assist you to the restroom or whatever you need. And I'm going to go over here and do a little bit of documentation. And then I'll come back in about 30 minutes to an hour just to see how everything is working. Is that okay?
Yes.
Alrighty. Well, I'll see you later, Miss Smith, and thank you.
Thank you.
Okay.